Hey, Dr. Birchler from ChiroHealth Spine Disc Center. I want to talk to you today about this concept of what's commonly called maintenance care in chiropractic. We commonly call that wellness care at our office, though that word differentiate might be more between the intention of the person using it. Same basic concept. And here's the basic concept. If you can do something that changes your body, if you continue to do that thing, can it keep the problem maybe from returning or worsening in the future? That's the basic question, okay, and that comes into play. So if I'm overweight and I'm out of shape and I exercise and I change my body and then I do nothing, what will happen? Like once I hit my goal and then I just stop exercising, what will happen? Or could continuing to do some level of exercise in that case continue to help the person maintain the changes they've already accomplished? And common sense logic, we all understand what the answer to that question is, right? And this comes into play in everything. If you go to dentistry, haven't been taking care of the teeth, haven't been flossing, haven't been brushing, cavities coming there, let's fill this cavity, let's make sure we're taking care of the teeth. And then if we do that, floss and brush and do that, could that limit the recurrence of, the gum swelling and bleeding, infection, that, cavities, things like that? Of course it could, right? It applies to anything, right? So how does that apply to chiropractic? I'm going to give you a mix of, kind of logic, common sense, and addition, and also some research that has been done on this, just kind of as an overview. So the basic idea is this: when somebody's having trouble, say with their spine, and they undergo chiropractic care for their spine or spinal disc decompression, say for a disc problem, and that person improves. There's data that has followed people for say a year, 9 months to a year following that, with every other week adjustments, like bi-weekly adjustments. And the basic concept is this: if somebody improves, say they have chronic pain and they improve during an initial course of treatment, commonly about 3 months of time, if they continue just to get treatment twice a month or every other week, they'll maintain or even slightly improve over the next 9 to 12 months. Less recurrences, better range of motion, those kind of changes there. And that study has been done. There's also been studies done in the work comp industry. So you have people injured at work, and then what do? Do you go to physical therapy? Do you go to a medical doctor, take some pain medication? You go to the chiropractor? You go get back surgery? I mean, these are the kind of things that come up, especially with significant injuries. And the basic, there was a study from 2011 that was kind of interesting, where the study basically looked at, here's injured workers, and they had medical treatment, like go to the medical doctor, take some pain medication, whatever would happen in that environment, available to them. They had physical therapy available to them. They had chiropractic available to them. And the basic result of this was that over the next year, the people that the workers that use chiropractic had the least recurrence and missed time from work. Surprisingly, maybe the group that had the most recurrence was the physical therapy group. The secondary group below chiropractic that had the least time from work was the medical treatment. And then there have been other studies that look at cost and things like that. And chiropractic is also more cost effective than these other. And gets people back to work faster than, say, medical treatment or things like that. So real physical problem, physical injury, correct physical evaluation, and kind of correction or treatment makes sense. It'll work. Then the next concept would be, okay, if that person got better, if that was effective or maybe more effective than other options, if that person was able to do something periodically once a lot of their initial treatment was done, then the data showed that they had less chance of having it come back again, missing work again, those kind of things there. And chiropractors have seen that for decades of time in practice with human beings, right? Got a bad disc, got this old injury, got this thing that bugs me, do this all day, whatever, and people just do better with maintenance type of care, right? And the logic with that is relatively simple. You're going to maintain better range of motion, better nerve function, better posture, all of these kind of things with having correct care of the spine. So that's a brief overview, and then I want to get a little specific on a couple scenarios depending on how you fit in. In our practice, we really have two main things we do. We have our chiropractic work and we have our spinal disc decompression work. Most people do just one of those things. Some people do both of them, but it depends on the person. And I've been through things myself in my own body, and so I've had to consider with caring for my own body what works best for me. I have for sure found that maintenance chiropractic care and a relatively high frequency of maintenance care I do my best at, especially athletically. When I'm doing competitive stuff, a lot of running, a lot of sprinting, things like that, I actually like to get adjusted like a couple days a week, and I do better than, say, a couple times a month. But I certainly do better with getting maintenance care than not doing that. I've also herniated a disc, big blown out disc in my back, had foot drop weakness, loss of reflex, major pain, disability for a period of time. And so I have that, and I didn't do back surgery, didn't do injections, didn't do medications, didn't do any of that, just did spinal disc decompression for that particular problem. And, I'm in my 40s right now. And so the question that comes up for me is once I got that really to resolve and got a good treatment effect, what do I need maintenance care? And my answer to that might be surprising, but here's my basic answer is for somebody that's younger, say in their 30s or 40s. I don't know if that's young, I guess depends who's watching, but seeing as most disc herniations, like they happen most commonly in age 40s and 50s, right? And they do happen outside of that, but the bulk of it is there in the middle of life, right? So I'm looking at that kind of age bracket there. So when you're in that age bracket, as opposed to maybe in your 70s or 80s or something, if the disc is still nice and thick, so if the cushion in the spine is not worn out, this model actually shows one that's worn out, but if the cushion is thick and not worn out, somebody has a herniation. Once we treat that, sciatica goes away, person's doing better. I don't generally recommend maintenance care to them. Now, if that person was like, man, this really helps me, I want to do that, I wouldn't argue with them. I like to do it myself on a maintenance care, but in terms of the necessity of it and all of that kind of stuff there, I don't necessarily recommend that, but it is a tool we can use, right? Now, you take the scenario of somebody who the disc isn't nice and thick. Maybe something happened a long time ago, time, age, the cushions are worn out. Well, when the cushions are worn out, and you can have this thing that goes and opens up the space around the nerves going down into your legs and your feet, and in the joints that should be like this, and then when the cushion wears out, the joints are jammed together, and you get them to separate. It feels good. People bend better, they move better, they sleep better, less issues down their feet, restless legs, these kind of things with these degenerative conditions. So as a guideline, I do recommend decompression maintenance care for people with degenerative disc. I think it helps. They do better, they function better, and it's a tool we have, and I would use it to have the best life you can, right? So hopefully that is a good overview of this concept with chiropractic, decompression, maybe what age bracket you're in, what your scenario was, and the frequencies involved. But as kind of a summary of the frequency, somewhere between once a month to once a week on chiropractic adjustments is effective. There's basic science data going back to 1980 that totally changed orthopedic medicine to show that the faster and more often you get things moving, the better, which is why they don't bed rest you anymore. You get your hip replaced, then they have you up walking. And so in chiropractic, if the higher frequency of adjustments, the faster you can get things moving, the more frequently, the better the outcome is going to be. So for somebody who's a high performer, who's an athlete, who just wants to be at their best, for sure, higher frequency. For somebody who's looking at I just want something that's effective and cost effective, maybe do once a month, twice a month. But in that range is generally pragmatically what works, and data, won't bore you any further with things behind it to say it's effective, it works, this has been done, people tend to do well. So that's my answer to that, how I think, what I do, for myself, and maybe some of the scenarios, and see where you fall in. If you have any questions about your case as far as maintenance care, what's needed, what's not needed, things like that, questions about frequency, of course, you ask me. We want to make sure you have the best care and you really understand how to use what we do here to get the better results so you can stay pain-free, healthy, and active naturally.